Today we're talking about something that can happen in an instant but has consequences that can last a lifetime: a dog bite. It's a scenario none of us want to imagine, whether it's a stray dog on the street or even a familiar neighborhood pet having a bad day. The immediate shock and pain can be overwhelming, and it's easy to dismiss a smaller bite or a scratch as no big deal. But here's the thing, and I really want you to hear me on this. Even the most minor-looking wound from a dog can pose a serious health risk, including infections and, most critically, rabies. Acting quickly and correctly in those first few minutes and hours is absolutely crucial. So what are those correct steps? It's easy to panic or feel unsure about what to do first. Do you wash it? Do you rush to the hospital? What about the dog? There's a lot of conflicting information out there, and some of it is dangerously wrong. That's why I've put together this video. I want to give you a clear, calm, step-by-step guide that cuts through the noise. We're going to walk through this together, from the very first second after a bite occurs to the follow-up care that ensures you stay safe and healthy. This isn't about scaring you. It's about empowering you with the knowledge you need to protect yourself and your loved ones. Think of this as your personal safety drill. By the end of this video, you'll know exactly how to handle the situation with confidence. We'll cover immediate first aid, when and why you must see a doctor, what to expect with vaccinations, and how to handle the situation with the animal involved. My goal is to make sure that if this ever happens to you or someone you're with, you won't hesitate. You'll know the protocol, and you'll be able to act decisively to prevent a small incident from becoming a major health crisis. Let's get into it. All right, the absolute first thing you need to do, and I know this is easier said than done, is to manage your immediate reaction. Panic is your enemy here. When a bite happens, your adrenaline spikes, your heart races, and your first instinct might be to scream or flail, but you need to consciously override that. Take a deep breath. Your primary, #1 goal is to prevent any further injury. Calmly and deliberately, create distance between yourself and the dog. Don't run, as this can trigger a chase instinct in some animals. Just back away slowly and steadily until you are in a safe location, inside a building, behind a gate, or far enough away that the dog is no longer a threat. Once you're in a safe space, your next task, while the event is still fresh in your mind, is to become a detective. Your memory is a critical tool for the medical professionals you're about to see. Try to recall as many details about the dog as possible. What did it look like? Was it a large German Shepherd or a small, wiry terrier? What color was its fur? Did you notice any unique markings? Crucially, did it have a collar or any tags? This could indicate it's a pet versus a stray, which is vital information. Also, think about the dog's behavior. Did it seem provoked, or was the attack sudden and aggressive? Every single detail helps build a complete picture for your healthcare team. Remember, this isn't just about identifying the dog for animal control. It's about assessing your risk. A well-groomed dog with a collar that seems scared is a very different scenario from an emaciated, aggressive stray showing strange behavior. Write these details down on your phone or a piece of paper if you can. Your mind will be racing, and it's easy to forget these crucial facts later on. Getting to safety and gathering this mental data are the foundational first steps that set you up for everything that comes next. You've removed the immediate danger and started collecting the evidence needed for your treatment. Now that you're safe, we move to the most important immediate first aid step you can take to reduce your risk of infection. This is non-negotiable. You need to wash the wound, and you need to do it thoroughly. Find a sink and turn on the water. Running water is key here. You're going to place the bitten area directly under the stream. The goal is to physically flush out as much of the dog's saliva and any bacteria from the wound as possible. The mechanical action of the flowing water is incredibly important. This isn't a quick rinse. You need to be patient and diligent with this step. Next, grab some soap. Any regular hand soap or bar soap will do. You don't need a fancy antiseptic soap at this stage. What's important is the soap's ability to break down fats and proteins, helping to lift and remove contaminants, including the rabies virus, which is fragile and easily destroyed by soap. Lather it up generously and gently, but thoroughly wash the entire area in and around the bite. Do this for a minimum of 5 to 10 minutes. I know that sounds like a very long time when you're standing at a sink, but I want you to actually time it. Set a timer on your phone. This extended washing is one of the most effective preventative measures you have at your disposal. After you've washed for at least 5 minutes, you can rinse the soap away completely under the running water. Once you're done, you need to dry the area. But don't just grab any old towel. You want to use a clean, sterile cloth if possible, or at the very least a fresh, clean towel or paper towel. Don't rub the wound vigorously, as this can cause more trauma to the tissue. Instead, gently pat the area dry. The goal is to get it dry without irritating it further. This simple act of washing and drying properly can dramatically decrease the viral and bacterial load in the wound, giving you a head start against infection. With the wound now clean and dry, it's time for the next layer of protection. We need to apply an antiseptic. This step helps to kill any remaining bacteria on the surface of the skin that the soap and water might have missed. You're looking for a topical antiseptic solution. Common and effective options you might have in your first aid kit include povidone iodine, which you probably know as betadine, or a chlorhexidine-based solution like Dettol. These are excellent choices for disinfecting the wound area. Take a clean cotton ball or gauze pad, apply the antiseptic, and gently dab it over the entire wound. Once you've applied the antiseptic, the next step is to cover the wound. Leaving a bite wound exposed can invite dirt and bacteria from the environment, increasing the risk of a secondary infection. You want to use a sterile dressing. This could be a simple adhesive bandage, like a Band-Aid, if the wound is small. For larger or deeper wounds, a sterile gauze pad held in place with medical tape is a better option. The key here is sterile. Don't just grab a random piece of cloth. The packaging on the bandage or gauze should indicate that it's sterile. This creates a clean barrier between your wound and the outside world while it begins to heal. Now, what if there's bleeding? A little bit of bleeding can actually be a good thing initially, as it helps to flush out the wound from the inside. However, if the bleeding is persistent or heavy, you need to control it. Take a clean cloth or a sterile gauze pad and apply firm, gentle, and continuous pressure directly to the wound. Don't keep lifting it to check if the bleeding has stopped. Maintain that pressure for several minutes. If the blood soaks through the cloth, don't remove it. Just add another cloth or pad on top and continue to apply pressure. This will help the blood to clot and stop the active bleeding. This next step is the most critical one, and honestly, there are absolutely no exceptions. You must seek professional medical attention immediately. I really cannot stress this enough. Even if the bite seems incredibly minor, like a small puncture or just a simple scratch that barely broke the skin. Even if you know the dog and believe it's vaccinated. Even if you've done a perfect job washing and dressing the wound. You are not a medical professional equipped to assess the full risk. And, well, the stakes are simply too high to make that judgment call on your own. Go to an emergency room, an urgent care clinic, or your doctor's office right away. When you get there, the doctor will perform a thorough evaluation of the wound. They'll look at the depth, the location, and the type of wound. A deep puncture wound carries a different risk than a surface-level abrasion. They will also clean the wound again, professionally, to make sure it's completely decontaminated. This is also where the information you gathered about the dog becomes invaluable. Tell the doctor everything you remember, the dog's appearance, its behavior, and whether it was a stray or a pet. This context really helps them perform a risk assessment for rabies, tetanus, and other bacterial infections. Based on this comprehensive assessment, the doctor will determine the necessary course of treatment. This isn't just about rabies. Dog mouths are full of bacteria, and bite wounds have a high risk of becoming infected, leading to conditions like cellulitis or even sepsis. The doctor will decide if you need a tetanus booster shot, especially if you haven't had one in the last 5 years. They will also assess whether you need a course of antibiotics to prevent a bacterial infection from taking hold. And most importantly, they will make the final expert decision on whether you need to begin the anti-rabies vaccine series. This decision is not something you can or should make at home. Let's talk about the anti-rabies protocol, because honestly, this is where a lot of people get anxious or confused. If the doctor determines you need it, which will almost always be the case if the dog was a stray, or if its vaccination status is unknown or out of date, you will start a series of shots. This is called post-exposure prophylaxis, or PEP. It's incredibly effective at preventing rabies, but you really have to follow the schedule precisely. The modern vaccine is given in the muscle of your arm, not in the stomach like those old myths you might have heard. It's a relatively simple injection, much like a flu shot. The standard vaccination schedule is a series of injections given on specific days. The day you receive your first shot is considered day 0. You will then need to return for subsequent shots on day 3, day 7, day 14, and finally on day 28. It is absolutely vital that you adhere to this schedule. Mark the dates on your calendar, set reminders on your phone. Do whatever you need to do to make sure you don't miss a dose. Each shot builds upon the last, training your immune system to recognize and fight off the rabies virus before it can reach your central nervous system. Completing the full course is your best defense. In some specific higher-risk situations, the doctor may recommend an additional treatment called rabies immunoglobulin, or RIG. This is typically recommended for severe, deep wounds or for any bites that are located on the head, face, neck, or hands. These areas have a high concentration of nerve endings, providing a more direct pathway for the virus to travel to the brain. RIG provides immediate passive immunity by giving you ready-made antibodies that start fighting the virus right away, while your body is still working on producing its own antibodies in response to the vaccine. The doctor will inject as much of the RIG as possible directly into and around the wound itself, with the remainder given in a muscle elsewhere. Now let's circle back to the dog itself. If the dog that bit you is a pet, belonging to a neighbor or someone you know, and it's safe to do so, there's an important observation period. The standard protocol is to try and have the dog observed for 10 days. This needs to be done by the owner, who should confine the animal and monitor it closely for any signs of illness. The key signs of rabies in a dog include changes in behavior, such as unusual aggression or lethargy, difficulty swallowing, paralysis, or seizures. If the dog remains perfectly healthy for the full 10-day period, it's considered scientific proof that the dog could not have had rabies in its saliva at the time of the bite. This 10-day observation can provide incredible peace of mind. If the dog is confirmed to be healthy after 10 days, your doctor may tell you that you can discontinue the anti-rabies vaccine series. This is a decision that only your doctor can make, so you must stay in communication with them. However, and this is a critical point, you should never delay starting the vaccine series while waiting for this observation period to conclude. You always start the shots immediately on day 0. You can stop them later if the dog is cleared, but you cannot risk waiting 10 days to begin treatment. The stakes are just too high. What if you can't observe the dog? If it was a stray that ran off, or if the owner is uncooperative, you must assume the worst-case scenario, that the dog could have been rabid. In this situation, there is no other option. You absolutely must complete the full course of the anti-rabies vaccinations as prescribed by your doctor. There is no 10-day observation period to rely on, so the vaccine series is your only line of defense. Remember, your health and safety are the priority. While observing the dog is a useful tool in some cases, the medical treatment plan prescribed by your doctor is the ultimate authority. We've covered a lot of ground today, and I really hope this step-by-step guide has made you feel more prepared and less anxious about what to do in this scary situation. The single most important takeaway I want you to leave with is this: you cannot afford to hesitate. You must take every single dog bite seriously, no matter how small it looks. A tiny puncture wound can be just as dangerous as a large tear. And please, do not fall for traditional or home remedies. I've heard stories of people putting things like turmeric, chili powder, or other pastes on wounds. These do not work against rabies and can actually increase the risk of infection and cause more harm. The only proven protocol is immediate washing and professional medical care. The reason we are so serious about this is because of the nature of rabies. Once a person starts showing symptoms of rabies, things like fever, confusion, agitation, the disease is 100% fatal. There is no cure, there is no treatment. It is a devastating and irreversible illness. But the good news, the incredibly good news, is that it is also 100% preventable with timely and proper medical intervention. That window of opportunity is right after the bite. By acting fast and following the steps we've outlined, you are taking control and ensuring a fatal disease never gets a chance to develop. Don't gamble with your life. I know that navigating the healthcare system, especially in a moment of panic, can be difficult. Finding the right place to go for treatment is a common point of stress. So I want to make you an offer to help. If you or someone you know gets bitten and you're unsure where to go, please reach out. Leave a comment below with your city or general location, and my team and I will do our best to help you find nearby government hospitals or clinics that provide free or low-cost anti-rabies treatment. Your safety is what matters. Thank you for watching, stay safe, and I'll see you in the next video.